malaria-safe private sector orientation is going on at the Doubletree Hilton today, and to host this whole event is John Hopkins. And from John Hopkins, we got a general introduction from Michael Ngatunga on what malaria is, how it pays to be a malaria-safe champion, how companies can get involved, and as well as the 4 pillars of how a company can get involved in becoming malaria-safe. So let's hear from Michael Ngatunga himself and see and hear about what John Hopkins as a company is doing to help companies come together and join the fight against malaria.
The United Against Malaria movement started in 2010 during the World Cup in South Africa, where they used footballers to advocate about malaria. Following the success of that, the campaign is continuing till Brazil 2014. So now, under the United Against Malaria campaign, there's a malaria safe initiative for the private sector bringing. So the United Against Malaria campaign brings the private and public sector together.
All right, so at the moment, behind me is the room where the panel discussion for the private sector is going on, where Modesta Lillian Mahiga, who is the managing director of Professional Approach Group, is facilitating the whole event. Now, Modesta Mahiga is an amazing icon in society. So today, she is here actually facilitating the whole event. So let's hear a bit from Modesta Mahiga herself and on what she thinks about malaria and the combating against malaria.
Raising awareness in the distribution of nets, and so there is intervention being made in terms of productivity at the workplace, but it is ultimately affecting Tanzania's development. And these are some of the issues that we'll share today. We understand that it's a health concern, and there is resources that are being galvanized worldwide. But what can Tanzania do, apart from the Global Fund and the money that it puts in, and apart from the Ministry of Health and Social Welfare and their efforts? What can Tanzanians do, and what can business interests in Tanzanians, how can they get involved without being overbearing on their resources and their plans in the fight against malaria? Because what is said right now is that we have made headway, but we haven't reached the critical mass, and we aren't yet at a pivotal area where we can top it over and say we've won against malaria. And so what do we need to do to give that extra push, such that Tanzania really stands at a place where we know that every other effort we're making to do business and develop the economy is supported because we do have a healthy workforce. And so today's agenda, if I may share, is going to move relatively quickly. I'm not sure how many. I know we've got the brief in front of us, and I don't know how much of a background we have. And so I'll introduce my colleague, Michael Ngatunga from John Hopkins University, and he'll give a brief background on malaria. Thereafter, we'll hear from the Tanzania Football Federation president, Mr. Tenga, and he'll talk about how the private sector can get involved in the fight against malaria. And we'll also hear from these, which are called bright spots, organizations that are already intervening and have really made headway. And later, we'll really address this question of what's in it for me and what does it take as a business interest to join the fight against malaria.
Visitations of malaria cases to hospitals have been cut by half, from 40% to only 20%. Deaths have been cut by half. In the past, used to be full of malaria patients. Now we have empty beds. Our doctors now have time to attend to other diseases. It's leadership that makes it different. If we maintain political will, take the right political decisions, and make the right interventions, I'm sure we should be able to eliminate malaria altogether. So no, everybody else will be happy.
So malaria basically affects 40% of the world's population, mainly Africa, Asia, and Latin America. And as the last WHO report in 2009 shows that we have 250 malaria cases. And as you can see, 85% of that is in Africa. And of the deaths of malaria deaths, we have 89% happening in Africa. Go ahead. In Tanzania, we have 90% of the population is at risk. We have 10 to 20 million cases annually. It's the number one cause of in and out patients in Tanzania. More than HIV, I mean, it causes more deaths than HIV. Sorry, go back. 60 to 80,000 annual deaths. Our aim is to actually get to eradication. But right now, where Tanzania is on the control bed, where we're trying to reduce the malaria burden on the country, and we're scaling up our interventions. This is just some examples of how you can protect yourself from malaria. Last year, there was a universal coverage campaign, which was completed in October. And basically over 18 million nets were distributed for free in Tanzania. The video showed, the indoor residual spraying is currently happening in Mwanza in the lake region. And that's basically the spraying of the walls. The reason they spray the walls is basically because every time a mosquito bites you, it has to rest. So once it lands on the wall, it's one of the ways that you can kill the mosquito. And malaria in pregnancy. Pregnant women should be taking 2 doses of SP. We're trying to scale up, because currently right now 40% of women are taking SP, are taking the second dose actually. So we're trying to get it up to 70% of women. This is basically how to get tested. A lot of times what happens in Tanzania is that when you get a fever and you automatically say that's malaria. So we encourage people to actually go and get tested as quickly as possible and to take the right medication, which is the Seto, the ACTs here in Tanzania. So this year, World Malaria Day is actually tomorrow, April 25th. And so the theme of this year is sustain gains, save lives, and invest in malaria. And that's why we brought you all here today, is to talk about how we can invest in malaria. A lot has been going on. A lot of interventions have happened, have been happening. And malaria deaths have actually been cut by half in a lot of African countries. But like Modesta said, we need to sustain these efforts. If donor funding is not always going to be there, and so once that dries out, we could then end up reversing back, and the number of people dying will go up. Like right now, Zanzibar is doing so well, but Zanzibar is not, too far from mainland. So if somebody from malaria goes there, and then, it would just end up going back to the old days.
We have a lot of companies that have shown up, that are showing initiative and taking steps towards eradicating malaria. With us is the malaria champion in Tanzania, Mr. Tenga, of the president of TFF, which is the Tanzania Football Federation. He will have a few words with us on how he, as TFF president, and TFF as a whole, is combating malaria. He has been mentioning how SECAFA and TFF has been doing so much to combat this disease, such as having billboards and adverts inside the stadiums during the football matches and so on and so forth. So let's go and hear from him directly on what he is doing and what TFF as a whole is doing.
Michael had explained exactly what football does. And what does it do? Just provide the forum for promotion. Young and Simba match is going on. 60,000 people get to the stadium. The match starts at 4:30, but people get there from 1 to 2 hours. So here is an opportunity for these guys to read messages about malaria. Excellent opportunity. You got billboards, fans get there, they'll see it. But it's not only those who go to the stadium. TV. People have got the opportunity now through football to read malaria messages. They get educated. You advocate about what could be done to fight malaria, etc., etc. So that's what we do as football in this campaign. But at the same time, Michael said very well, children, even some of us, would love football like crazy. So for a young girl or boy, seeing Giovanni or Kolo Toure or whoever, or Okwi, yeah? Okay, talking about malaria, saying, I do sleep under the net, and encourage somebody to sleep under the net. This has got a direct impact on the behavior of so many people, particularly those who love the game of football. So basically what football does is to use its popularity in promoting these messages against malaria and therefore promoting the campaign against malaria. For purposes of this meeting, I would want you to know that, and I've mentioned it initially when I was introducing myself, I say, this is not just TFF. The FIFA, football body, had endorsed malaria. And that's why the 2010 World Cup was one of the biggest forum for the campaign against malaria. Our regional body, SECAFA, is a partner. So all our tournaments, just like all TFF tournaments, are used for promotional purposes. In Africa, I know Uganda, I know Ivory Coast, Mali, Senegal, DRC, they're now engaged in that. Somali is involved, Kenya is involved, Zambia is involved. Recently, we've been talking to South Africa as a football federation. Of course, the stakeholders in South Africa, they've been involved for so long, but the Football Association is not, but from now on it's involved, etc. So football is a big partner, and again, I'm saying we are doing so because it is necessary that we do so.
And very soon, we'll start our session on the panel discussion. Michael will share a little bit about one of the success stories, what I call bright spots, and what they've done in Tanzania. And then we can get into our discussion of what what kind of areas we could each respectively in our organizations get involved in.
The campaign launched in 2010. We had 2 companies that were committed to become malaria safe. Currently, we have almost 10 companies that have joined the campaign. What that means, there are over 10,000 employees being protected and educated right now. So it's helping the companies, and it's also tying together with the government's efforts, which is scaling up malaria initiatives. I'll give you, before I go into SSB, I'll give you one example from Stanbic. Emma mentioned before that they were distributing nets this year, well, this week actually. So following the distribution of nets, free nets last year, there were gaps that were left. There was basically hospitals, schools, boarding schools, and orphanages. So what Stanbic did is they got in touch with us, and we got in touch with the Ministry of Health, and we identified which hospitals needed nets and how many they needed, and